This podcast is brought to you by North Carolina's electric cooperatives.
This is NC Spin, an unrehearsed discussion on issues of interest to North Carolinians. Now, here is your moderator, Tom Kemp.
Few people in North Carolina have a better perspective on how our state is faring with COVID-19 than Congressman Greg Murphy. Greg is a doctor who's served in our state legislature and now represents the 3rd Congressional District. We get his insights after these brief messages from our underwriters.
In more than 21 years on NC Spin, I never endorsed a product or sponsor, but I volunteered to do this message for family physicians. Over the past 40 years, my family doctor could quickly diagnose my illnesses because he knew my medical history. Evidence suggests I'll live longer, have a higher quality of life, and save 33% on health care costs. I believe in my trusted relationship with my family physician.
Family Physicians, your trusted healthcare advisor for life.
Life's busy, but you're in control. As an electric cooperative member, you have access to lots of tools to help manage your home energy use and budget, so you can focus on what's most important.
Thank you, Greg Murphy. Our state is fortunate to have you representing us, and we appreciate you taking the time to talk to us. Do you find it just a little bit serendipitous that just as the time you're getting elected to Congress as a medical doctor from the 3rd District of North Carolina, it's months before the biggest pandemic our state has seen in a generation?
Well, it is interesting timing. I got lowered down into impeachment and then into coronavirus. People are starting to wonder if I have something to do with national calamities. So I hope that's the case.
Yeah, you're just bad luck. How many other people in Congress, elected representatives in Congress, are MDs?
I think there are 12 MDs.
Wow.
No, I think there are 12 in the doctor's office, but that includes dentists and some doctors of pharmacy, probably about 8 physicians.
I want to get talking about COVID-19, but I think our audience would be interested in knowing, what was it like when y'all were negotiating that $2 trillion relief plan? I mean, what was the atmosphere like?
The atmosphere was tense. It was a lot of differing desires. You know, Chuck Schumer and Mitch McConnell had worked out a deal in the Senate, and then Speaker Pelosi said, no, I want this extra stuff. So what, from a 900-page bill to a 1,400-page bill with a lot of extraneous things. Fortunately, the vast majority of that stuff that had nothing related to COVID-19 was taken out.
You came back home for the Easter break, and I'm sure you've been talking to a number of your constituents. What are they saying to you?
There's a great amount of fear, apprehension, uncertainty. You know, I'm wearing 2 hats. I wear the hat as a member of Congress, and I wear the hat that I've worn for over 30 years as a physician. And so I'm using both of those hats really on a daily basis. I've been looking at the science of this really since the end of January and studying things. And I have tried to touch every resource possible to understand the healthcare aspects of this. But also, you know, I've been talking with business owners, farmers, how severely they are affected by the shutdown. And there's a lot of anxiety and worry.
Particularly small business people. You probably would not want me to say this, but we scheduled this interview for this particular time because of the fact you are going to be volunteering your time on call as a doctor at Vidant Hospital because of doctor shortages over there. What's it like in our hospitals now?
It's a very different mood because it's almost like it's very similar over here in Eastern North Carolina that we're preparing for a hurricane. It's almost anxious. It's preparing for this big surge that everybody has predicted. Fortunately, right now we're feeling a little bit of relaxing that, hey, maybe we're not going to be getting as bad a surge as some had predicted. But I tell you, the hospitals in some ways are empty because people are not coming to the emergency department.
Well, we've told them they couldn't do elective surgeries, and this is affecting them economically.
Yeah, it's devastating to all manners of hospitals and physician practices. And this is one of the things, you know, that I wrote about and that I've talked about is that I think in the moment we need to start pivoting and changing what we're doing in the healthcare industry.
We've been staying at home now since the beginning of April, Governor Cooper's orders. Understandably, many are getting weary from all of this. Did you support Governor Cooper's stay-home directives when he first initiated them?
You know, it's interesting because we had a telephone call the day prior to his bringing that out with the Secretary of Health and Human Services and all the members of Congress. And at that point in time, only certain counties were doing it. And I brought up to the fact that, in my opinion, my medical opinion, isolating counties is not going to do anything. You know, you're going to have people that drive from Greenville to Raleigh and Raleigh to Nash County, et cetera. And until we did something statewide, that's the only way to control things.
Yeah.
So, yes, I was in support of that.
We've now got over 5,100 cases in North Carolina. We've got more than 400 people hospitalized. We've had 110, 115 deaths. DHS Secretary Mandy Cohen said recently that it looked like the doubling rate for infections was slowing down some. And she attributes that to the stay-home orders that have been issued. Do you believe that these separation policies have slowed down the curve, sort of?
I definitely do. You know, I got on social media a good 6+ weeks ago and showed the graph of how we flatten the curve. Now, let's just remember there were two reasons to flatten the curve. Number one was to save lives. Hands down, that was the primal one. But the second one, even just as important, was that we were trying to blunt the curve so we would not overwhelm our hospitals and resources. And now we've seen that we've been able to handle the resources, getting, you know, still people, there's PPE short, but we've done a much better job at testing, at getting people the supplies they need. So it's been the right thing to do. Now we need to start building our economy.
Well, I was going to ask you, I'm sure you know about the pressure that this group, Reopen North Carolina, is putting on our state leaders and everybody in our state. Governor Cooper said that if we did away with the stay-home directives, the separation directives before the end of April, it would be a catastrophe. The question is he going to extend them beyond the end of April? Would you support that, or what's your feeling on this?
I think, you know, I wrote an op-ed and I talked about what I thought was a surgical approach to this. We approached this whole thing with a shotgun, which in my opinion was the right thing to do. But now that we know more things, I think that really more of a rifle approach is necessary. Let's look at those who are most vulnerable to succumbing from this, most likely to be hospitalized and pass away from this. Those are the individuals over age 65 or under age 65 who have other chronic diseases, kidney disease, heart disease, lung disease, bad diabetes. I think for those individuals, the ones who are most at risk, that order probably needs to continue. But the vast majority of individuals, if we start slowly opening up our shops, our restaurants, our beauty salons, keeping that social distancing, keeping washing the hands, wearing masks, I think that's a much better and more intelligent approach to opening up the economy.
And you did a YouTube video on this that I called you immediately. I told you it was the most common sense thing I had seen, and I want to get to that in a second. But during this past week, there's just been a great controversy about who has the authority to determine and make the decisions about stay home. Is it the governors and local representatives, or is it the federal government? And you've served at both levels, both the state and federal levels now. What do you say about who has the authority?
The 10th Amendment in the Constitution is very clear on that.
Pretty clear, yeah.
That powers not given to the federal government in the Constitution are therefore by the states. And I personally think that states know better how to take care of their own populations. We don't need to do the same thing in North Carolina that New York does. New York doesn't need to do what Wyoming does. And so, the federal government there is to give us an overarching plan with this, but I think it has to be tailored locally.
But
and I think that's the smart thing to do.
If the state contradicts what the president wants to do, does the state have to worry about perhaps losing funding or losing benefits?
I don't think we're at that point by any means.
Let's hope not.
This is, I've said this before, we're kind of building a plane while we're flying it. And there's going to have to be a lot of leeway, a lot of patience. A lot of folks have, expressed their desires to make sure that they're in control of their situations. But I don't think we'd ever have to go there.
You started off by your video. which I think should calm a lot of people. You said that before we start easing these restrictions, there's some more testing we need to do. Explain what you're talking about and what you think needs to be tested and what results we need to see.
Well, they're essentially, in my opinion, Tom, there are four things that need to be done. We need to get more medicines available. We need to have something called point of care testing, where if somebody comes into a doctor's office or somebody is going to have surgery, that they could be tested and find out immediately whether they, number one, have had the virus, or two, have been exposed to the virus, because those are two different conditions. And the second type of testing is that we're going to get to is something called surveillance testing, when we're going out into communities and checking to see what the prevalence of the virus is. That way we can know, look, is there a hot spot in that community? Maybe we need to really work on
So is there one
quarantine.
point where you say in this, the prevalence below this level is such that we can begin relaxing restrictions, or above this level we should keep them on? Some data point?
I think, again, I think that's going to be the ultimate goal. But I think there are some restrictions that even without that point of care testing, even without that surveillance testing, that we can start relaxing things a little bit. I don't think we have the time, and I don't think we can wait for that.
Do you think that perhaps maybe these restrictions can be eased in some areas of the state? Like many rural areas in North Carolina have very few instances.
Definitely. I'm going to catch a little bit of this, but I kind of think that parks should be able to be opened up. And, we have some of those in certain areas, as long as people, again, limit 4 to a group, they socially distance like they're doing. We have to be smart about this. We're at the point now where we have data, we have good data, that we don't need a blanket approach, but definitely our rural areas.
This is what really impressed me so much about your plan, because you said we need to ease into this. And you mentioned, for instance, restaurants. Elaborate on that.
Right. So the restaurant industry has been hurt tremendously by this, and they've been able to keep by, some of them, by doing takeout. But what we, in my opinion, we should do, and I expressed this to the governor a couple of weeks ago. I said that we need to open our restaurants, maybe limit capacity to 30%, limit 4 to a table, make sure that there are tables between tables, make sure the wait staff are wearing masks and gloves. Let's do all those things, but let's get people back out into the public again, but in a safe manner.
It just makes so much sense. And maybe even the customers themselves are wearing masks up to the point where they get their food served to them. Other examples of how you think this common sense easing back can be done?
Well, let's look at, I haven't had a haircut in a little while. Let's look at barbershops, beauty salons. Oftentimes their chairs are more than 6 feet apart. Let's stagger the appointments, making sure that the hairdresser or the barber is wearing a mask. The same thing with the client, as long as that's feasible. Again, those are smart, common sense things that can be done, which will really limit the exposure of the virus, but get the economy going again.
So let's take your early steps. And what you said was we're going to ease into this situation. Let's take your early steps. How will you know when it is time that we could relax even more?
Well, I think it goes back to the point of care testing and the surveillance testing. That's going to be when we can say, okay, you're okay in this community to open things up a little bit more. But until that point in time, and which is going to be, I think, about a month away, I still do think that the vulnerable populations we talked about are the ones that probably need to continue. They're staying at home.
From your perspective, do you think that this economy is just going to rebound back quickly, or is this going to be a slow process?
I think it's going to be a slow process, because not only are we have to open up stores, we have to get people with consumer confidence again. And a lot of folks are still, even regardless if they're not in an at-risk group, going to say, I'm going to stay home regardless. And so it's going to be a step. I think, to be very honest with you and very blunt, we're not going to turn this around in a year. It's going to take a couple years for us to get the vaccine, get all these things, and get consumer confidence back up again.
And this patience, what I hear you saying, we're going to have some patience in this. And of course, people want patience, but they want it right now. I mean, so what do you say to these people who want this whole thing to just all of a sudden go back to where it was before? How do you speak to those people and tell them they got to have patience?
Tom, we are in an instantaneous society now. if you and I, when we were growing up, wanted to find something out, we went to the World Book Encyclopedia, we went to the Dewey Decimal System and looked something up. Now you can find something out in 15 seconds via Google. So we are in an instantaneous society. But people have to realize that this is a different time. This is not going to be something that's going to happen instantaneously, or else it's going to be calamitous for both the health of our nation, but also the welfare, because then we'll have to go back to full restrictions all over again.
I know Congress is talking about another round of relief, and they're deliberating on some legislation now. What would you favor for that next round?
Well, we're finding out again data that the PPP program, the Payroll Protection Program, has been very, very successful. Over 200, and I was on a call yesterday with Secretary Mnuchin. There were over $260 billion that have now been applied for. It's been wildly popular. That's not enough money because
a lot of businesses are saying they've gone to their local institutions and the institutions is loaned out.
Well, some of that's true, some of it's not true, and I'm going to actually be doing a teleconference call today with our lenders. But we're definitely going to need more money for the PPP, for the program. We also may need more stimulus money itself. The problem is here, Tom, we can't just keep printing money forever. That's just not the recourse. And so there's going to have to be, also with the first bill that came out, there were some industries that got left off and some loopholes, one of which I'll talk, if you want to, I can talk about the unemployment loophole. So we need to do some definite correction.
Greg, is this going to turn into another one of these bitter partisan political fights? I mean, there was some dissension about the $2 trillion package that was passed, but in the end of the day, everybody came together and they worked together to get it done. But it looks like right now it's getting ready to get nasty.
Well, it's very unfortunate, Tom, because we had some that wanted to put, this was supposed to be a coronavirus stabilization bill. That's the purpose of it. But they wanted to put in climate change. They wanted to put in stuff with voter ID. Those are fine to have those discussions, but they don't need to be done in this particular bill. And I'm fearful that that's what they're trying to do with the forced stimulus bill, is trying to do that all over again. And that's just, in my opinion, I'm going to call it what it is. It's nonsense.
Yeah, I agree with you. We've all forgotten the fact that on March 3rd, just a little more than a month ago, we were having primary elections in North Carolina. How has this virus affected the 2020 elections?
I think that's a good question. Unfortunately, our general elections are not until November. I think we'll be in a much, much better place now. I think it's just like everything else. It's put it on hold. It said, hey, look, we got to chase this rabbit right now, but it'll come back to it. I think it's exceedingly unfortunate that some are people trying to make political plays on this disaster. It just doesn't speak well for us as a nation.
Do you think that it's possible or even advisable to postpone the November elections?
I don't think we're at that point. I mean, that's 6 months away. We've seen how things have changed literally in 1 month, which is changing hour by hour. I think that's vastly premature to talk about that.
What do you think about this concept of voting by mail? There are many who are saying that with the fact that this virus is going to probably restrict turnout in November, that we ought to open that up more. What do you think? You were elected during a period when the 9th Congressional District was having this major controversy and abuses and violations of absentee voting. So you do have a perspective on this.
I think, again, it's premature to talk about that, but I think if there's one thing that would be ripe for fraud and deceit, it would be national mail-in voting. And I personally think that would be a disaster. We just don't have the mechanisms for that, and there are a lot. We saw issues with it, as he said, in the 9th District. We don't need those issues nationwide.
The Census Bureau just recently announced that they were having tremendous trouble getting people to turn in their census forms. In fact, in North Carolina, we reported not long ago that only about 50% of our people had actually returned their census data. And the Census Bureau is now asking for an extension for being able to conclude the census. What do you think of that?
Well, in some ways, I'm not sure why that is, because if everybody's at home and they're getting their mail, Why can't they do it? If everybody and their brother is online now, you can fill it out online. That's what I did. Why can't they do it? I think it's laziness more than anything, and that's unfortunate. So,
Well, and I'm not sure many people
make
understand the repercussions of all of this, because this does, in large measure, affect the receipts that we get from the federal government and from other funding sources.
Yeah, definitely. I mean, that's how federal funding is apportioned. That's how we would, in North Carolina, most likely, if everything would continue, get another member of
Congressional
Congress.
seat,
So
yes.
it's critical. Yeah, it's critical for North Carolina.
Well, it has another implication also, and that is if they are successful, I think they want to extend it until like April of next year. So now we're in 2021, when theoretically our legislatures should begin the redistricting process, and that's going to just throw that up in the air, isn't it?
Well, it will. I'm not so sure that that's a reasonable request. I don't think it needs to be extended that long. So.
There's another group of people who are saying that our prisons are just hot spots for the coronavirus, and that we ought to begin releasing prisoners, particularly those who are not convicted or guilty of violent crimes. Where do you stand on that?
That's a hard one, Tom. I don't see any reason why measures that shouldn't be taken anywhere else, like in a hospital, et cetera, cannot be the same ones done in a prison. And so I think it might be a little bit of an excuse to let people go, let people out of prison before they've paid their debt. I think safe gap orders are in order. And, if anybody can be quarantined, by God, you have a captive audience literally in prison.
Yeah.
So I'm not quite so sure I agree with that.
I don't want to get into the shoulda, woulda, coulda of what we should have done or could have done or would have done or whatever like that. But particularly from you have such a unique perspective as a doctor, as a former state legislator, and now in Congress. What have we learned from this? What is it you think that we should be taking away from this and preparing for next time around?
Well, I think it's very frivolous to think that we could have put this nation in bubble wrap, and that we could have not had this virus come to the United States. I think what it has shown is that in China they are an authoritarian rule. They slam things down, and if you didn't do what they told you, you got locked up. You went into prison. We don't have that in the United States. We still have a lot of folks that disregarded this. I have friends. I've spoken with physician friends in New York. I've spoken with several times. He said people six plus were still getting on elevators and everything together. This is a challenge we have as a democracy and free will. I agree. We shouldn't say, yeah, you should have done this, you should have done that.
That doesn't serve any purpose at this point in time.
No, none whatsoever. None whatsoever.
And so I think the question is, what did we learn from this, and how do we prepare? Because in all likelihood, this is going to happen again.
Yeah, it will happen again. This virus is not going to go away, or there'll be another virus that's happened. We need to know that we need to have a coordinated response. We've seen that our protective gear has run out in the national supplies. That needs to be updated regularly. We need to have a response plan for our nation's hospitals. We need to make sure they're adequately funded, and make sure our county health departments are adequately funded, because they're the ones really the most granular that are dealing with these kinds
right
of
down on street level, serving the public. Any final words
right.
you want to say to our statewide audience, Greg?
Yeah, well, I think it's important to try to take this in perspective. The vast majority of individuals, if they get this, are going to be fine. We have a population that is most at risk, and those are the people that need to be quarantined and kept away. But we also have another part where I think the health and welfare of our nation in the response to the virus is being affected. We're having people not go to their doctor's appointment with chest pain or cancer follow-ups. So I think one thing we're going to learn, Tom, is in 5 years looking back at this, we're going to say, all right, well, how many people actually lost their lives because of the treatment, because of what we did in pushing people away from medical care versus the virus itself? There is no right answer. I'm not saying that there is. I'm saying, but that's going to be an important consideration.
And it's going to be very difficult for us to be able to look back in hindsight and say, well, we should have pushed this button, or we should have turned that knob, or we are very fortunate, Greg, to have you representing us in our Congress. And I appreciate you taking the time to talk with us on NC Spin. I have to tell you, it gives me personally a great deal of comfort knowing that you're up there and your common sense approaches to so many of these things. The fact that you can factor in being a doctor at the same time being, a legal representative of the people makes all the difference in the world. Thank you for doing this.
I appreciate it.
We
God
wish.
bless. Stay safe.
I was getting ready to say, we wish you well and staying safe as you are volunteering at hospitals and going back to Washington. Well, you've heard Dr. Greg Murphy and our spin on the issues of North Carolina. We hope you've enjoyed this special interview and hope next week we can return to our regular format. During the course of the week, you can stay informed, sign up for our free weekly email newsletter, give your feedback, and read my weekly column. So visit our website, ncspin.com, or catch NC Spin on Facebook. While there, subscribe to our podcast and our YouTube channel, and join us next week for balanced debate for the Old North State. Until then, stay informed and watch out for the spin.
In more than 21 years on NC Spin, I never endorsed a product or sponsor, but I volunteered to do this message for family physicians. Over the past 40 years, my family doctor could quickly diagnose my illnesses because he knew my medical history. Evidence suggests I'll live longer, have a higher quality of life, and save 33% on health care costs. I believe in my trusted relationship with my family physician.
Family Physicians, your trusted healthcare advisor for life.
Life's busy, but you're in control. As an electric cooperative member, you have access to lots of tools to help manage your home energy use and budget, so you can focus on what's most important.
North Carolina Channel is made possible by the financial contributions of viewers like you who support the UNC TV network.